Ahead on Pathways.
Everyone wants us. That is a fact. People need imaging to diagnose.
They're fast, focused, and at the front lines of diagnostic discovery. CT techs are the unsung heroes, turning snapshots into life-saving answers.
Hello, listeners, and welcome back to another episode of Pathways, part of Northern Light Health's Healthy, Happy, and Wise podcast series. Just a reminder, this season we are talking all about 2-year or less programs to get your foot in the door and work in a healthcare career. So today we're talking imaging and particularly CT techs. I've got Makenzie Farley, a CT tech, and Justin Dyer, the manager of imaging services at Northern Light AR Gould Hospital, here with me today to talk about all of that. Thanks for being on with me, guys.
Thank you for having us.
Thank you.
Okay, so first question, and maybe Makenzie, we'll start with you. What is a CT tech?
CT actually stands for commuted tomography, which is a form of X-ray. So with CT, you are actually getting a 360-degree view of the patient, view of the anatomy, versus X-ray is two-dimensional.
Okay.
So CAT scan allows the radiologist to diagnose a little bit more as far as pathology and to get a better look at all-around anatomy.
Okay. So in terms of imaging, Justin, we're talking about a particular modality right now, which is CT tech, but there's multiple things to do with imaging, correct?
Yeah, that's absolutely true. So, just in our department alone, we've got mammography, ultrasound, X-ray, nuclear medicine, MRI, PET CTs, and then our just traditional CTs as well. So there's a lot of different avenues to go. And really, it kind of starts with that the degree in rad imaging. And then you kind of can branch off anywhere. I think maybe ultrasound might be the only exception where it's a separate program, but there's a ton to do. There's a ton of different anatomy. Every single piece of equipment does something different. All important. We diagnose based on these images, and these doctors need those results. So imaging is definitely a hot commodity in the hospital and for the community. Everybody needs us, from outside providers to internal providers. So
yeah, and imaging, you're really I've spoke with another imaging professional before who said they're the eyes of everything that happens for a patient, which is really kind of cool. So I guess Makenzie, do you only do CT tech or do you do multiple?
Nope, I started out as a regular rad tech, X-ray tech, and then I cross-trained into CAT scan. So that's kind of the nice thing about you get your general X-ray license, and typically you can cross-train into CAT scan, MRI, mammography. It's not necessarily additional schooling.
Okay. So tell me originally, what was schooling like for you?
Schooling was a lot. It's a 2-year program, and there's a lot to learn within the 2 years. Okay. Obviously, you want to make sure that you learn everything you can about radiation safety. So that's the main thing that they teach you, along with the different positioning in X-ray. But it's a fun program. I enjoyed it. I enjoyed meeting new people, learning a bunch of different stuff I would have never thought of, And like Justin said, there's so many modalities within our department, but there's also modalities outside of our department. You've got radiation therapy that you can go into that treats cancer patients. You've got interventional, where they do heart procedures, heart catheterizations.
Okay.
Cath lab, where they go in and you can create fistulograms for dialysis patients and all this stuff. And within general X-ray, we also go to the OR, the operating room. We're in on a bunch of orthopedic procedures, hip replacements. If someone fractures a femur, they go in and they'll put a nail down. We're in for that. We're in for a lot of cases where cancer patients will have portacaths put in to receive their chemo. So we go in with our C-arm, take a lot of imaging there. We also do fluoroscopy, which is basically live X-ray. It's like a video, basically, not just one still X-ray. So we do a lot of pain clinic in our department. Dr. Wofford is our pain clinic, or he's our main pain clinic doctor, and he does back injections a lot. So people with arthritis, chronic back pain, he'll go in and he'll do some steroid injections, and that gives patients about 3 months of relief. Wow. We also do a lot of procedures with our radiologist. We'll do joint injections. we'll do a lot of swallowing procedures where we actually take, it's called barium.
Okay.
All it does is basically blocks x-rays. So it shows up kind of as a dark or a white thing going down the patient's throat. So we can actually see like dysmotility in the esophagus. We can look for pathology in the small bowel and the large intestine. There's a lot of stuff we can do in radiology. That's just a start.
Oh my gosh. Yeah.
yeah.
No, you started talking and I was like, what?
Yeah,
I didn't even know you could.
There's so much we can do.
I thought
yeah.
I'd go to a room and you take a picture of my arm and tell, send it to the doctor and they tell me if it's broken.
A lot of patients think that it's just x-ray, but there's so much more that we do in the background.
Oh, that is awesome. Okay. And so you mentioned a couple of other things too. So you mentioned rad tech and you also mentioned intervention.
Yep.
Say that for me.
Interventional.
Yes.
Radiography.
Yeah. Okay. Yes. So there will be, for all you listeners out there who want a sneak peek at what's coming up the rest of the season, there's actually going to be 2 other episodes, one focusing on rad techs in particular, and then one focusing on interventional as well, to talk a little bit about what that's like. So it's really neat that you mentioned that, and you can kind of cue me up for those episodes. So let's head back to CT Tech right now. Okay. So tell me a little bit about that particular modality and exactly what you do with that.
So we do a lot of outpatient CAT scan, outpatient and ERs, I should say. So we'll just do a typical outpatient. Typically they'll be scheduled a couple weeks in advance. We'll get the order from their doctor. Our receptionist will schedule it. Once the day arrives for the patient's exam, they'll come in. We have a series of questions that we have to go through with them. Obviously, if you're within the age of reproduction, we have to ask chance of pregnancy.
Okay.
If a patient is pregnant, we don't like to radiate you, especially the abdomen area, because fetuses are very susceptible to radiation.
Okay.
And that's one thing that you really focus on in school.
Oh, yeah.
So there's different types of CAT scans that we can do. We can do a dry scan, which is without contrast, or we can inject contrast into a patient's vein. And that highlights their blood vessels, their organs, everything inside their body, basically.
Oh, okay.
So that kind of allows the doctor to see a little bit more pathology. If you have like a mass or a tumor, typically if it's like malignant, then blood flow will be going to those masses and the contrast will show up in those masses.
Okay.
So if we're giving a patient contrast, we have to ask if they've had it before, if they have an allergy to iodine, because it's an iodine-based contrast.
Okay.
And then if they have any kidney issues. So if they have kidney issues, we typically don't like to give contrast because it can be very hard on the kidneys.
Okay.
Especially if a patient's on dialysis. Or if they're not on dialysis, I should say. If they are, then it's okay that we give them the contrast because they'll be getting it flushed out in dialysis.
Right.
So the patient comes in, we'll just ask them these questions, have them sign a consent form. If we're giving contrast, we'll start an IV, obviously.
Okay.
A lot of patients come in with portacaths, which goes back to the OR. We go in on those. But typically we'll have oncology come down and access the port, and that's just another way that we can give the contrast.
Oh, okay.
Versus starting an IV.
IV, right.
Yep. So really, a CAT scan takes like 2 minutes. It's really not that long. We'll do a dry scan, which lets us set up our parameters of the anatomy that we want to include. And then if we're giving contrast, we'll inject the contrast. And depending on the body part that we're imaging, it's a different timing for the contrast.
Okay.
Obviously, if you're doing an abdomen, it takes a little bit longer for the contrast to get through to the organs of the abdomen versus the chest.
Okay.
So that kind of goes with like circulation of the blood flow. But we inject that, we do a scan about a minute later, and the patient's done.
Wow.
So it's in and out within a total of probably 5 minutes or so.
So it's really quick. How many images do you think you do in a day?
Like patient-wise?
Yeah.
Oh, probably 25 to 30, I would say.
Wow.
With outpatient, ERs, inpatients.
Yeah. I know last year alone we did about like 10,200 in a year. And we're probably projected to hit that again, if not more. It's a hot corner. Like CT is a unique in the sense it's a 24-hour service. I mean, this is something that the emergency department relies on for it. It's like you'd look at your major traumas that you get through or our strokes, you have to have those CTs. So you're seeing everything from, obviously the stroke, but then it could be a car accident, it could be a gunshot. You're seeing all of those come through the CT unit.
Wow.
Yeah, we see every trauma that comes through the ER. Every coach stroke has to come to us. We're basically the first stop when the patient gets to the emergency room. So,
holy moly.
yeah, it's an adrenaline rush for
Yeah, I
sure
was
when
gonna
those come
say.
through. But I mean, it makes us stronger techs. Just go with the flow and makes us
Go
stronger.
with the flow. Get
Yeah.
it? I
Yeah.
like it. That seems like a little CT tech humor there. I like
Yeah.
it. So I didn't even realize, how much you guys are doing, especially 24-hour service. So Makenzie, I'm assuming since you're here with me today during work, you're a day CT
Typically.
tech? Typically? Okay.
Yeah. I do cover vacations. Our
Okay.
overnight tech is on vacation right now, so I was working the overnight last week. So
Okay.
typically with the overnight, we just have one tech on. So I was responsible for both CT and X-ray,
Okay.
but it's not too bad.
Okay.
So happy to be back to the day shift though.
Yeah, I'm sure. So tell me, how many, Justin, how many people do you typically have on staff in imaging and then running, CT and X-ray?
I'd say about 34.
Wow.
I'm thinking about, so 34. Right now, the hard thing with any imaging is not just Northern Light in Presque Isle, Maine, but just the lack of staff. So we have a lot of travelers in our department to maintain the volumes that we're doing. So I think we have probably 4 travelers on, which makes things different because you only get them 13 weeks. You never know what you're going to get. But when they come on board, it's a tremendous help. We never want to stop a service or slow it down. I mean, it's just an access issue for patients. We want to get them in and out and have fast care quickly. So we have a lot of staff. In a perfect world, I think we'd have closer to 40.
Wow.
But
So you kind of touched on this a little bit, but we are seeing a need for imaging professionals across the system at Northern Light Health, but I know it's not just our hospitals that are suffering. It's becoming a shortage statewide and nationwide even. Why is that, do you think?
from my perspective, what I've seen is aging out. It looked like I've seen a lot of CT techs and X-ray techs who have been in this field for a long time.
Mm-hmm.
And they're just transitioning out of it. So I don't know if there was a gap. I know up here, there's not a lot of education for it. We have a community college that doesn't run a RAD program. Closest one would be Bangor, Maine, and that's a 2.5-hour drive. And those people aren't going to come to Aroostook County. That's another obstacle too. And then the other option, the availability now is that staff can go anywhere in the country and become a traveler. The pay is incredibly competitive. It's almost not sustainable for a hospital to do, but they can do it because they're in a pinch. So hospitals will pay these rates, but they can visit and travel the whole country. We have people that go to Hawaii for assignments or California. Oh, I like snowboarding. I'm going to go to Colorado. I'm going to go to Maine. People can choose where they want to go. And typically we see that with the people first starting their career. They can explore, then they settle down and start a family, and that's when you start seeing people who are going to stay in the area. But it's just we don't see the volume that we would love to see up here, at least.
Yeah, I think a lack of education is definitely a huge proponent of not having the staff that we need, not just with RAD, but anything in imaging, sonography, MRI. There's hardly any of that within the state of Maine. I think there's one school right in Lewiston.
Yeah. I think that's one thing that Northern Light's done a really good job on is that we try as hard as possible to keep things in-house. So Makenzie learned her CT component in-house. She did it right here at the hospital. We've started doing online programs, and X-ray and CT are not that category. So you do need to go to an actual school. So much clinical time and components to that, like you really want the hands-on training.
Right.
But sonography, we can do that all in-house. So we can train you here. You can do your class modules online, and you can just do your clinicals with our staff. But in X-ray, you can't. And that's really where you got to get that degree and then come on board, and then we can train you for that next part. You can do CT in-house. So we're trying to take those pieces, under our belt. That way we don't have to send people away.
I like that. And I know Makenzie was saying she was cross-trained while she was here. And that's what Justin just mentioned. So you did your 2-year program for RadTech, were cross-trained in CT. but they can be cross-trained as long as they have their rad. They can cross-train in pretty much anything.
Pretty much. And a lot of them do have certification exams towards the end. So like I look at nuclear medicine, super, super specialized. You can take that program if you hold a rad license. You can take your certification for CT, MRI, mammography.
Okay.
You can, yeah. And that's stuff you do in-house. You just go and take your exam and you pass that, you got that certification.
So we're not only sitting here talking about CT Tech, we're sitting here talking about doing that 2-year program and then basically being able to move into anything. And everything, even cross-training and being available to do multiple types of imaging. So the prospect for someone coming into this career to move up and to learn and to grow is huge.
Oh, for sure. It's CT, especially like CT. I think a lot of people come on board and they see it's exciting. It's really meaningful work. You're doing biopsies, you're treating cancer. Like the sickest patients in the community are gonna have a CT, but then you're also getting, like, as much as nobody likes to see a trauma or anything heavy like that, it keeps
you on your toes.
It keeps you on your toes.
Yeah.
It really does, and you want to be involved with it. And does it take its toll? Absolutely. Like there's sometimes you'll see techs come out or nurses crying. It's a hard. Some of these are really bad injuries. Even a scaffold fall or like the car accidents we see. It's pretty serious stuff. But it's engaging to these people. Like it's like if someone was working in the OR, you're like, there's no way. I see blood, no way. Not that we're freaks or anything, but we live for this stuff. Like it takes a lot out of you, but you enjoy being there and you enjoy helping. And at the end of the day, it's patient care. And like, who else is going to do this? It takes a certain kind of person. And CT they're tough people. They're tough and they're smart. And they're not scared. And they're gonna if they're scared, they're not going to show until that patient's gone.
I like that.
Yeah.
So Makenzie, we're talking about all these things and you're telling me all these different things about imaging and CT. And I'm like, how in the world did you even learn that this was a possible career route?
So I originally wanted to be a nurse
Okay.
out of high school. And then I job shadowed in the emergency room and I said, no way, that is not for me. And then I job shadowed in radiology and I fell in love with it, doing sports all through high school. I did make a few trips to the emergency room, with sprained ankles and broken bones and all that stuff. And it just was fascinating to me that, with a push of a button, you can see a patient's bones. You can see the inside of them, really, and so I did some research and it was a 2-year program and I'm like, why not try it, and now I'm here, been with Northern Light for 4 years. So it's been pretty rewarding and it's meaningful too, with, like Justin said, with CAT scan, like we do see the sickest patients, a lot of cancer patients for sure. And you start building relationships with these patients because you see them every 3 weeks, 4 weeks, when the cancer doctors want them to have a scan to see how the cancer is progressing or if the treatment's working. So you do start to build those relationships, and it's meaningful when the patients come in and tell you how much that they appreciate you.
Oh, I love that.
Yeah.
And, before I ask Justin another question, let me just say, I don't think I realized either how patient forward you are. So these, as you continue to talk about this, I would just assume you go in, people would take the picture, but you're not. You're dealing directly with patients.
Yep. It's not as long as like a nurse would be face to face with a patient. We're probably with a patient for a maximum of 10 to 15 minutes, but that's really all the time you need to, for them to appreciate what you do and for you to make a difference in their life.
Yeah. I was going to say it must be nerve-wracking. Especially when you say you're seeing the sickest patients or trauma patients who are scared out of their minds and have no idea what to expect.
And we're trained, if a code does happen on our table, we're trained, how to deal with that, what to do, the steps that we have in place for that. Personally, I have had a patient code on the table, and it was very nerve-wracking. It was an adrenaline rush, but I just took my training and, ran with it, Luckily, we really don't like to have one CT tech work by themselves, especially during the day shift because we're so busy. So it does help to have another person there with you, just to be moral support, if anything
Yeah.
else.
Which is why staffing, I think, is so important.
Yeah.
So Justin, I asked Makenzie, but how did you learn about imaging when it came time to look at careers and career paths?
I never did. I never thought I'd be in medicine.
Oh,
It fell in
okay.
my lap. No, I've always had a business background. It has always been something I was interested in. And I put an application out there, resume to somebody, and they filled a job. And then I ended up in eye care services.
Okay.
And I worked in an ophthalmology clinic for 8 years and got into leadership that way. And then somebody told me there was an opening here at Northern Light, and they said imaging. I was like, God, can't be that bad. And why was I wrong? There's a lot to it. It was a good year and a half before I felt like I'm okay. I think I'm okay.
Yeah.
It's hard, but I think for me, it was a good thing not coming from a medical imaging background. I think that's something that was really important to the staff, because I look at the other hospitals in the area, or maybe even downstate, and it's really hard to separate management from doing the images. Like a lot of at least up here, the managers are imaging professionals. So they're working the floor just as much as they should be taking care of the department. So really for me, my whole job is to support the team. I want to make sure they're in a good place to be able to care for our patients. So it's, that's really my big, I want to make sure Makenzie has all the resources she has. So if she's
Gotcha.
having any obstacles in her position, I'm going to make sure that I can do my best to make sure they're out of her way so she can have a straightforward day. I mean, I always want everyone to come in and go home content and happy and know that they did something important. There's nothing worse than going to work and dreading what you're doing. And
Right.
you can't have that with this field, because if you're off your game, it could have some really bad, the quality is so important to me, and I know it is for these people. So if we miss something, someone could die. So
Yeah.
we need to be on our A game. So long story or short story, I got in this by error, by chance, and I'm glad I'm here. It's been 3 years here now, and I'm learning something every single day.
That's awesome. And, not that imaging is not important at every single hospital, absolutely. But I think it's important for us to point out that we are in Aroostook County.
Yeah.
We are in Presque Isle, Maine, a very small community, large in terms of the size of it, but the amount of people and the people who live here, it's your neighbors, it's your friends, it's your family even. So I think maybe that puts even more of an importance behind taking care of the patients that come through your doors, because they're your neighbors, they're your family,
that
they're
can
your
be
people.
challenging too.
Oh, I'm sure.
Because as a tech, we can't tell a patient what we see on their scans or their x-rays. We leave that up to the radiologist to make the diagnosis.
Right.
You have to put a smile on your face and go out and tell the patient, okay, we're all done. The doctor will be in touch with you. And so that's kind of the hard part too, especially if you do have a personal relationship with them.
Yeah. And I know they ask. I mean,
They do.
Who wouldn't ask,
Yeah.
if you're nervous and you just kind of want to know what's
Yeah.
going on, it's hard not to ask.
Yeah.
So kudos to you guys for maintaining that professionalism. What would you say to people who are listening to this podcast to encourage them to look at imaging CT tech as a potential career path?
I mean, it's a very rewarding career. There's so many opportunities to branch off. You could become a manager like Justin. You could just stay a regular tech. You could become a supervisor. There's so many opportunities, and you really just need that 2-year x-ray background for most of the modalities, and then you can branch off into whatever you like.
And I'd say Northern Light Health is super supportive in that growth.
Oh, absolutely. So we have a ton of different programs. We honestly, at this point, I wish it was like this when I was growing up, or at least going through school, but there's so many earn and learn programs.
Right.
We are bending over backwards to get people back into the community. So it's trying to grow people within Aroostook County. So if it's our way of supporting them through school, tuition, generous sign-ons, anything, or relocation, just to get them back here is a big deal. But just to get their foot into the program, we're going to do anything we can. We have so many students that go through the department, and we've got about 8 students that are going through right now. And even the shadows we get through the high school, I tell every single one of them, it's like, this is a 2-year program. I went to school for 8 years. Don't do that. I mean, you could if that's
Right.
where you want to go
If
with
that's
it.
what you want to do,
But it's a 2-year program. It's rewarding in a sense that it's patient care, and you're going to feel good about what you're doing. The flexibility within the schedules. I mean, there is overnight, but in X-ray, you don't have that. But it's a very stable job. You can go anywhere you want with this position. Any place in the country is going to want to hire you, and it's an attractive wage. It truly is. And then if you're going to go up into CT, it gets better. If you want to keep branching, it gets better. So for a 2-year program, you couldn't ask for a better gig. Truly, I think about all the trades and stuff like that are, they make great money now, and this is one of them. And it only goes up from there with experience. Here's a step ladder. So every single year you're being reevaluated and you move up a step. So it's a rewarding job. It's definitely a great wage for a starting out position for 2 years. Yeah, you can't beat it, truly. So.
and then the room to grow and continue to.
And quickly too.
Yeah.
And quickly. So I know Makenzie, she only waited a year before she's like, okay, I'm ready for CT, which is, I think, appropriate. You really want to get a good year under your belt
Right.
of general X-ray. So I think that she did a great job. But yeah, there's just it's whatever you find. We've had people come in and they fall in love with like mammography. Like, I think I want to be in mammography. So it's finding your comfort zone. But I think it's just exciting to get in. So if you're looking for a career, 2 years is nothing. It's going to fly.
It flies right by.
Yeah, and you've got a lifetime of a career that's rewarding, pays great, and has flexibility.
And you're going to have less student debt. And
Yeah.
you're going to be able to, I mean, those are all important things, especially right now in the economy that we're in right now. It's important to think about those things.
Yeah.
Yeah. And you're constantly learning too. Like, I'm still learning stuff to this day. I've been a rad tech for 4 years, but medicine's constantly changing.
Well, maybe you're right. I mean, like the use of like AI, we're using a lot of artificial intelligence that's being introduced into CT, whether it's identifying strokes quickly before it even hits a radiologist. So it will just identify if there's any bleeds.
Wow.
And we're trying to introduce more. There's stuff coming up that we're going to be introducing here. So the technology's changed. The days where you would see film, now it's all digital. So things are twice as fast. Like she said, it's a couple minutes for a scan now. We just got a brand new CT scanner in October of last year. The quality, the speed, the reconstruction time, it's amazing what you can do with these. So it's also, I mean, if you're into tech, you're going to love this stuff. It's fun to play with. It's cool to explore and see what these, machines can do. It's impressive.
I hadn't even thought about that aspect of this job and the fact that technology is constantly changing.
Yeah.
And so you've got to keep up with that.
Yeah. And as far as CAT scan, like, it's not just scanning a patient 2 minutes and you're done. We do a lot of biopsies under CAT scan. So the radiologist is next to the patient the entire time. We actually have fluoro as part of our new CT scanner.
Okay.
So we're able to stay right next to the patient the entire time of the biopsy, just one hit of a button, and he's able to see what he needs to see. We do a lot of lung biopsies, bone marrow biopsies, liver biopsies. We could basically biopsy any part of the body under CAT scan, and it's safer.
Yeah.
Just because the doctor can see exactly where he's going.
Less invasive, all the things.
Yep.
Oh.
That probably takes about 20 minutes, half an hour or so to do one of those, but
Wow.
yep.
I mean, that's incredible. I learned so much on these podcasts. Let me tell you.
And you work really close with the radiologist too. You worked hand in hand with him, and the one we have here, he's great.
Yeah, I was going to say, it sounds like you guys have a lot of teamwork that happens across with your colleagues, but also with the radiologists and the physicians and surgeons and nurses, and trauma doctors.
Yeah, we work closely with almost everybody in the hospital, for sure.
Everyone wants us. That is a fact.
Yeah.
The people need imaging to diagnose. So
Yeah, absolutely.
Yeah, it's a key part in medicine right now.
Awesome. Well, is there anything else that you guys can think of that you'd like to share with our audience?
if you're ready to relocate and start a great life in Rooster County, we would love to have you. But no, as CT imaging, whatever the route you want to go, it's a great experience. It's a great position to have. And medicine's not going anywhere. We're always going to need this. The longevity is going to be there. So if we're scared to take a step and try something, and even if it's not, try shadowing. Just check it out. It's a great field. And, everybody here, or I would imagine anywhere, would be happy to just show it to you, just to introduce it.
I think I can echo and say, through my job doing marketing communications for specifically for recruitment, I've had the ability to or opportunity to speak with several different imaging professionals across all different modalities. And I can tell you that every single one of them really does love what they do. And I don't know how that is for other careers and other specialties, but it's something about imaging. The people that I talk to just truly, truly enjoy the work that they do, and they're very passionate about it. So I don't know if that's just an imaging thing, but it sure feels like that whenever I speak to someone just like you, Makenzie.
Yep, definitely.
Yeah. We like doing the patient care. If we don't have to place a catheter or anything like that, that's not for us. So I think this is
I like
why
doing
people
IVs,
enjoy.
but that's about
Yeah.
it.
So it's if nursing's not for everybody. So I think people overlook the imaging piece, and it's you still have that patient care. You downplay it a lot, Makenzie, but the interaction you have with your patients, it's like their worst day when they come in for a lot of these patients.
Yeah.
And the talent you and your peers have to be able to make them feel comfortable, even if in that short time, means everything to them. And I think that speaks to the quality we have here and to what you bring to the table for Northern Light. So
Yeah, a lot of people think we're just button pushers, but there's a lot more to that, especially in the background. Like I said, you got to put a smile on your face when you know that this patient is about to get some bad news.
Yeah.
And sometimes you just have to be a comfort for the patient, someone for them to talk to. A lot of these patients come and they don't really have a whole lot of family left or anyone around them. So sometimes they just need somebody to confide in them, and you just have to be that patient or that person.
That person for that patient. I love it.
Yeah.
I think there's going to be no doubt in anyone's mind after they listen to this episode that you guys are absolutely more than just button pushers. So thank you so much, both of you, for coming on and explaining this career path with me. It's really been a pleasure.
thank you so much.
Yes, thank you.
Thank you for listening to this episode of Pathways. Please join us next time for a new episode. There are several ways you can tune in on our website at northernlighthealth.org/healthyhappywise. We are also on Apple, YouTube, and Spotify, which makes it easy for you to listen on the go on your favorite app.